Giselle is ready to undergo. Giselle is coming in for a rhinoplasty. We're doing it next week, I guess, right? Or shortly thereafter. Why are you interested? What brought you in?
Well, I just wanted to change the whole look of it. I thought it was too much.
A little too much.
Potato-like.
Okay, and so from the side view, the nose goes down a little bit here, particularly when you smile. You sort of feel like the tip comes down. So we want to get the bump gone, and then we also want to raise the tip up just a little bit, but not too much. And then from the front, narrow you a little bit over here, and narrow you a little bit over there. That sound right?
Yes.
Yeah? You concerned at all?
Not at all. I think I'm in good hands. I trust you.
I hope so. And how long have you been thinking about this?
I've been thinking about this for like a good amount of my life. Yeah. I finally have the courage now to do
that. I was going to wonder, what got you to the stage where you decided to get something done?
I think the time is now, and it's right.
Terrific. All right. Here we go. Hi, it's Dr. Miller. We are now just 1 week post-op.
Yes, we are. And loving it.
And she's very unhappy.
So happy.
So how was the week?
It was tough the beginning of the week with the congestion, but then that came off, and I just wanted to get the cast off, just take it off.
And we didn't. You know what? We got you in there. We took the cast off, and we forgot that you were gracious enough to actually go on video.
Yeah.
But you must have been so happy to get it off.
Oh yes, it was wonderful.
And then when you looked in the mirror and
I loved it. I was like, oh my god, I was not expecting that. It's perfect.
It's what you wanted.
Yes,
Good.
Exactly what I wanted.
Yay!
It's nice and cute and small and dainty. Big.
All right, so let's take a quick look over here. The nose was off a little bit to the right side, and it was a little too bottom heavy compared to the top. You had a little bit of a bump, and the tip sort of came down here. So there was too much fullness in the super tip, and the tip came down with an angle here of more like 90 degrees. We'd like it up maybe closer to 110 degrees or so. Excuse me. The base view was tilted to the right side, asymmetric nostrils, and on the 3/4 view, you hated that view, right? Yeah, she did not like that view. Okay, so here we are now 1 week later. You can see this is straight, if not even a little bit of a scoop, and turn the nose a little bit. I love it.
It's so nice.
It's really great. Now the tip is still really, really swollen. That's to be expected. It's just going to look better and better and better as time goes on. From the base view, you can see I made a little incision over here. You can't even see that. I mean, that'll be almost imperceptible in a matter of weeks or so. And then I also made some small little incisions over here and over here so that we can I narrowed the nasal base. And that's also why this area is swollen. And if you see any little areas of glue or tape here, that was just to show you how authentic we were. We really did just take the cast off. I promise you. It wasn't. The cast came off today. But we'll see you again in around 3 weeks or so, around 3 to 6 weeks. Do you have any questions at all for post-op care?
Yeah. Am I able to wash my hair, blow dry it with a blow dryer?
Yeah, absolutely. You can, let me go through your regular post-op routine at this point. You can notice that your nose is going to change shape over the course of the next weeks and even months. Don't be surprised if it's swollen in the morning and it's a little bit less or more defined at night, and then it gets swollen again in the morning. Focus on what it looks like, not what it feels like, because it may get a little bumpy and lumpy, and in fact it will get a little swollen the next 2 or 3 days now that the cast came off. Okay? You can go back to your regular washing your face and brushing your teeth, moisturizer, makeup. You can go back to vitamins, any kind of protein shakes, anything like that, you're all set to go.
And would I be able to put makeup on the incision on the
Yes.
side too now?
Yes, no problem, no problem. Working out, use common sense. If you work out and it hurts or it swells up, too much. If it doesn't hurt and it doesn't swell up, then you're okay. Common sense. Okay?
Sounds good.
Any last minute questions?
No, those were all the questions I had.
Okay, great. We got to give this poor woman some energy. She has no energy. She comes in and the office is just really, really, dead. We can't. Great, so we'll see you in around 6 weeks or so, and we'll make sure that we get you on tape here in 6 weeks.
Yeah,
You're going to have your
for
own
sure.
YouTube channel, I think.
Yay.